Hello, thank you for having the opportunity to share with you this talk about COVID-19 vaccine safety and toxicity. I'm Professor Lacombe, infectious disease specialist working in Paris, France. Here are my disclosures. I would like to set up the scene of this talk by reminding you of the different vaccine platforms that have been used this year to design vaccines against COVID-19. And first of all, the vaccine currently developed, which are of 8 types. The first type are nucleic acid vaccine, and especially RNA. And we'll talk a lot about microRNA with the two vaccines from Pfizer and Moderna, who are the ones who have been commercialized first. And then we'll talk about viral vector vaccines, and especially the non-replicating vector, but there are also replicating vectors used for this platform. And then another platform is using virus vaccines weakened or inactivated, but as they are not commercialized right now in Europe, we won't talk about that and the toxicity of those vaccines. And then protein-based vaccines as well, either protein subunits or virus-like particles. But here again, they are not commercialized in the European Union so far. And first of all, after this very brief overview of the vaccine platforms, I wanted to remind you of what we call an event of interest after immunization, just to show you that this phenomenon of event of interest have been summarized from a multinational network cohort study, just to remind you that a lot of those side effects that are reported right now with vaccines, with the COVID-19 vaccines, are in fact events that are quite well known from other vaccines. And very important to remember that according to age, some of them are quite very frequently reported. And for example, here you see that non-hemorrhage stroke, acute myocardial infarction, or deep vein thrombosis are quite frequently reported at the older ages. And for example, as well, immune thrombocytopenia, myocarditis, and pericarditis, or disseminated intravascular coagulation are also reported more frequently with the older age. So those events are more events associated with immunization in general and not specifically due to one type of vaccine. It's very important to remember that, because a lot of vaccine hesitancy is due to the side effects which are attributed to COVID-19 vaccine, but you know that in fact they are reported with all kinds of vaccines. So if we now focus on RNA-based nucleic acid vaccines, and especially those two here, the Comirnaty and Moderna, which has been commercialized as early as December in the European Union, the short-term efficacy and safety, mainly safety here on this slide from clinical trials, are from phase 3 trials. And you see, for example, with the Pfizer, almost 4,000 patients have been included in phase 3 trials, and a little more than 30,000 with the Moderna phase 3 trials. And you see that for the local events with the Comirnaty, mainly pain at injection site, redness and swelling have been reported, mainly in the age quite young, between 16 to 55, and less with the second dose. If we switch to the Moderna for local events, mainly pain at injection site have been reported, and the intensity was the same with first or second dose. If we switch to systemic events, the reported events were fatigue, headache, chills, and muscle pain. Here again, more at younger age than older age, and more with the second dose. And with the Moderna, was more with the second dose, and was mainly fatigue, headache, chills, myalgia, and arthralgia. Some events of special interest have been reported with Comirnaty. First of all, the herpes zoster following vaccination, and especially in patients with autoimmune inflammatory rheumatic disease. We got those data from a case series published in Israel. You see almost 500 subjects with autoimmune rheumatic disease and about 90 without that kind of disease. And herpes zoster have reported in the patients with autoimmune disease. and that was only monometameric herpes zoster, so not quite a severe event of interest. Another event of interest, which is right now under scrutiny, are the symptomatic acute myocarditis reported in adolescents in the United States. 7 teenagers, all within 4 days after the second dose. None of them had a multi-system inflammatory syndrome, and all of them recovered with typical treatment for myocarditis, such as non-steroids, anti-inflammatory drugs, or IV immunoglobulins. Regarding now the safety of Comirnaty in immunosuppressed patients, we are gathering data on that kind of this special group of patients. And for example, here you see the patients with cancer treated with immune checkpoint inhibitor. This is also a case series from Israel, 134 patients with cancer treated with immune checkpoint inhibitors, and they were matched to controls on age and gender. And no autoimmune myositis has been reported, and there was more muscle pain in cancer in patients with cancer than in the controls. So we have to warn our patients about that kind of side effects. But you see that here again, it's not a very important side effects. And we've got very new data regarding the safety and immunogenicity of the, so it's not here the Comirnaty, but that's the vaccine from AstraZeneca in HIV infected patients. And you see here that they were reporting more fatigue, headache, muscle ache than in HIV negative patients. And here again, we have to warn our patients of that kind of side effects. Regarding the events of special interest with Moderna, not of interest so far, other than the classically reported side effects with other vaccines. If we switch now to the viral vector vaccines with non-replicating vectors, we've got 2 so far, the Vaxzevria and the Janssen vaccine. Regarding the local events and systemic events, with the Vaxzevria, about 11,000 patients have been included in clinical trials to report clinical events, the local events or systemic events. And you see that for the local events, it was more pain and tenderness, stronger at first dose than in younger age. And regarding the systemic events with the Vaxzevria, stronger at first dose and younger age, fatigue, headache, muscle ache, and malaise. With the Janssen vaccine, and I remind you that it's only 1 dose, a little less than 20,000 patients have been included to report local events and systemic events. And the local event, there was mainly pain at injection sites. And for the systemic event, headache, fatigue, myalgia, and mainly at younger age. Of course, you have all heard about this very specific adverse event called the thrombotic thrombocytopenia after the Vaxzevria vaccines. And in fact, what has been reported at the beginning of April was several cases of unusual thrombotic events and associated with thrombocytopenia developed after vaccination with the adenoviral vector encoding for the spike protein antigen. And another paper published a little bit later has reported this case series from Greinacher and Scully. So you see here patients from the UK and from Germany, and they all reported the similar cases of unusual thrombosis events associated with thrombocytopenia. Until now, this syndrome has been related to an autoimmune heparin-induced thrombocytopenia in the absence of use of heparin. And in fact, the pathophysiological pathway was the presence of activated antibodies against platelet factor 4, whose origin is associated with the adenovirus itself. I've put here the care and management of that kind of very unusual syndrome. So when you see a patient with an acute thrombosis and thrombocytopenia syndrome or with isolated thrombocytopenia, it has to be referred to the hematologist, who will perform a series of tests And according to the D-dimer level under 2000 with normal result of coagulation test and fibrinogen levels, this syndrome is really unlikely. But if those symptoms and biological tests bring a D-dimer level more than 4,000, low or normal fibrinogen level, and no evidence of an alternative diagnosis, then you can qualify that as vaccine-induced thrombosis and thrombocytopenia. No, the platelet transfusion should be avoided, and you should use IV immunoglobulin, consider the use of glucocorticoids, and administer a non-heparin anticoagulant. This is very important, non-heparin anticoagulant. And you could consider a treatment to increase a fibrinogen level more than 1 gram per liter, and then perform the HETA-LISA. If it's positive, then you can continue treatment. And if it's negative, you have to review the diagnosis and treatment and consider an alternative of functional HETA. And I wanted to show you the comparison between the central venous thrombosis after adenovirus immunization. So here you see between the Janssen vaccine and the AstraZeneca vaccine, that's very important to make difference between both side effects, and the central venous thrombosis have very different characteristics um, considered when you consider it to be associated with the Janssen or the AstraZeneca. So you see here, for example, that regarding the delay between the days to admission, so the event and the day to admission, it's shorter with the vaccine from AstraZeneca. The D-dimer level is higher with the AstraZeneca. The functional HETA is more positive than with the Janssen, and there is a higher risk of the presence of intracerebral hemorrhage with the Janssen, and the prevalence of internal jugular vein thrombosis is higher with the Janssen. So you see that it's not really the same kind of central venous thrombosis events. An event of special interest, which is starting to be reported with all vaccines. So it has been first reported with the AstraZeneca, but it's now reported with all vaccines, including microRNA. It's what we call the systemic capillary leak syndrome, either new occurrence or severe exacerbation of systemic capillary leak syndrome. So you see here the characteristics of 3 patients who presented with an exacerbation of the very rare syndrome, which contraindicates further vaccination. You see the patient 1, patient 2, patient 3, very different gender, different age, and the kind of symptoms were also different. For example, for patient 1, that nausea, vomiting, syncope, hypotension, and tachycardia. For the 3 patients, you see that they all had hypotension and tachycardia. One of those patients unfortunately died, and the 2 others were discharged. And the treatment is the same for all patients, so that IV fluid, vasopressor, antibiotics, and stress dose corticosteroids. So this is an event of special interest, which is under scrutiny with all kinds of COVID-19 vaccines. And I wanted to finish this talk by a special focus on vaccination during pregnancy, which is a kind of complex decision. I think that this paper, the position paper from the Open Forum Infectious Disease is really important, because we all had the question of should we vaccinate the pregnant women who we know are at risk of severe cases of COVID-19. And you see here that multiple professional societies offer recommendations to assist pregnant and breastfeeding people as they choose whether to undergo vaccination. And this decision is kind of challenging for many, but considering the paucity of data as a non-risk of coronavirus disease during pregnancy likely outweighed the not yet fully elucidated risk of SARS-CoV-2 vaccines. So that's until now quite reassuring safety and efficacy profile among pregnant people. So Probably it's more important to vaccinate pregnant women, especially during the third trimester, than letting them to face the risk of a severe COVID-19 disease. And we all know pregnant women who have been hospitalized in ICU, intubated with early cesarean section to save the baby. So definitely, I would encourage vaccinate the pregnant women. So, as a summary, millions of subjects in the USA and Europe have been vaccinated with one of the four available vaccines, two mRNA and two viral vector based. In countries where the majority of citizens have been vaccinated, significant decrease of COVID-19 disease incidence have been noted, as well as decrease in mortality. The safety, short and mid-term, is so far good for all vaccines, and there is a signal of thromboembolic disorders with adenovirus-based vaccines. But remember what I've told you of that kind of side effects, which are reported with all vaccines, and especially when you use vaccines at a very large scales, and especially according to age. Benefit of mass vaccination greatly outweighs the risk of vaccine associated adverse events, and a specific information should be given to subjects vaccinated with adenovirus based vaccine. For example, how to recognize signs of thromboembolic disorders, and guidelines for a specific management of vaccine induced thrombosis should be released at healthcare professionals levels. And I wanted to point out this event of interest, which is right now under scrutiny, the capillary leak syndrome, which has been described as a very rare event, but we should be aware of that kind of events. And again, I would really encourage you to vaccinate the pregnant woman, especially during the third trimester. Thank you for your attention, and I will meet you again for the Q&A session.